I'm really excited to talk about this topic. It's near and dear to my heart personally, and I'll tell you how I got involved with this, and then hopefully give you some information that will get you interested in the notion that dementia doesn't have to be a death sentence. So let me say a little bit first of how I got involved with this. When I was 51 years old, I became demented. And not in the metaphorical sense of the word, but literally demented. I was losing my memory and I was losing my mind. I was running a clinical trials research center. I've done over 100 clinical trials with all kinds of medications. I was a geriatric psychiatrist. I had worked on 20 long-term Alzheimer trials, so I have a lot of experience with dementia. And I came to realize that I was as cognitively impaired as my patients in the dementia trials. I had developed chemical sensitivity and I became allergic to everything. I was covered with rashes and hives. I had extreme fatigue and I couldn't get out of a chair for a year. But the worst part was all that inflammation that was happening in my body was eating up my brain. I would do cognitive testing with my Alzheimer patients and I would give them 3 words to remember in the mini mental status test. And I had to write those 3 words down because I couldn't remember. I had 2 sets of words, and I'd used those words for more than 20 years, and I couldn't remember which one that I had done. I would get confused dialing a phone number, and I'd have to dial it again, sometimes more than once. I forgot how to do things on a computer. And I would ask my poor husband over and over, how do I do this? And he'd get annoyed because he would say, I just showed you that. And I didn't remember that he had showed me. I had trouble driving. And I really completely lost the ability to back up or parallel park. My brain just couldn't sequence those things. One day my husband got in the car with me and he said, Kat, what's wrong with you? You're like a little old lady. And I said, I don't know, when you're driving, like so many things are happening and I couldn't, my processing speed was diminished and I couldn't sequence all those inputs coming at me. And I was a good driver before and I'm a good driver now, but I really wasn't driving too well then. I developed auditory processing problems. I couldn't understand what was being said. I kept going to my ENT and asking for hearing aids. And he would say, well, you just have a mild hearing loss. You don't need the hearing aids. And one day on another trip, once again, after having a moment in a restaurant, a quiet restaurant where I couldn't understand anything that was being said, I was just getting a snatch of every word, he looked at me funny and he said, this isn't in your ear, it's in your brain. So I had lost the ability to decode words whenever there was any background noise. I was in my early 50s, and when I treat patients with dementia in their early 50s, it goes really quickly. It's quite different than late onset dementia. So if I hadn't have learned about food as medicine, and what do you need? I hadn't learned food as medicine and learned about functional medicine, I would certainly be drooling in a nursing home years ago. So I'd like you to know that that's how I came to learn functional medicine. So let me go ahead and get started with the talk, and let's see. Okay. Here's the first important point that I want to make. Alzheimer's is a neurodegenerative disorder, but it's not a mysterious brain disorder that just happens. It's a reversible multi-system illness, and it's from toxins and infections and inflammation and lack of hormones and our diet and our lifestyle. There's also a strong autoimmune component that I'll tell you a little bit more about later in the talk. So there's reasons that this neurodegeneration happens. And if we find and address all the causes, then we can stop what's attacking the brain and help it to heal and regenerate. So it's a multifactorial disease. It's rarely due to just one thing. It's multiple things. And so we have to look at all of these factors that are contributing if we want to reverse this disorder. And I find a lot of people are writing books right now and saying some really useful stuff about reversing Alzheimer's, about the diet and the nutrients and the sleep and the exercise and the meditation, and those are all essential. And that's where you have to start help the immune system and reverse things, but you have to go deeper for most of the people I work with, looking at the infections and the toxins and the hormones. Now, I'm just going to say a word or two about neuroplasticity. That's a whole lecture in and of itself, but our brains do have an amazing capacity to heal. So if we can stop what's injuring them, there are many different ways to nurture the brain and support the brain. And people from all kinds of disciplines, probably some of you in here work with that area. But when I went to medical school in the early 80s, we were taught that you were born with all your neurons and that at 18, that was it. And it was downhill from there. And now we have really great data showing even at the time of death, when people are dying, they've put people in scanners and given them new learning tests. And they can see that new synaptic connections are happening even then. So it's a pretty exciting thing. So if we can stop what's attacking our brains, we can, not sure now what to do. I hit something wrong, Frank. Then we can reverse things. I don't like my patients to focus on genetics because when people say, oh, I have these Alzheimer genes, they perceive it as a death sentence. It just becomes a self-fulfilling prophecy. And it's really important to give people the belief that no matter what their genes, that they can heal, that genes don't equal destiny. We know now about epigenetics, and we know that it's our diet and lifestyle and other factors that turn our genes off and on. So even if people have a double ApoE4 gene, which I work with many people that do, I see them get better. And so we have to not focus too much on the genes, though a little later on I'll say a little bit about some of the dietary issues that are unique to the ApoE4 gene. Okay, thank you so much. I'll try not to hit the wrong thing. I'm not sure what I did. Okay, so a little bit about ApoE4. This is the Alzheimer gene, and it's also called the fat bucket gene. And these are some of the things that the ApoE4 gene does. Its main function is to transport and store lipids, hence the name, the fat bucket gene. And people that have this allele tend to store their fats and hold on to them, and they tend to have problems with lipids because of it. It also regulates glucose metabolism, some neuronal signaling. I'll say a little bit more about the inflammation, and it affects the mitochondrial function. So ApoE4 was ApoE was an interesting mutation that happened back when early man separated from primates. So when we became Homo sapiens and came down out of the trees onto the ground is when the ApoE gene started to express. And the ApoE variant is an inflammatory gene. And so when we came down out of the trees, then we're more vulnerable to predators and getting stuck on sticks and getting parasites. And so you need inflammation to heal from those kind of problems. And so it was adaptive in that time. And early man didn't live very long, so they didn't have problems with chronic inflammation. And this is what we have now when we have decades of inflammation in our blood vessels and our bodies and our brains. Then we're having problems with diabetes and heart disease and Alzheimer's disease. So there's three forms. There's a ApoE2, ApoE3, and ApoE4. And please don't ask me about ApoE1 because I have no idea why there is not an ApoE1. I didn't get time to research that, but there's only three forms that I know about. So the ApoE4 does confer the highest risk for Alzheimer's. ApoE3 has the lowest cardiovascular risk, and ApoE2 has the lowest risk for metal toxicity. So there's perhaps some advantages, but they assort out in different ways. So the highest risk is with the E4s, the lowest with the E3s, and intermediate with the E2s. However, the E3s have their own set of issues because people with ApoE3 seem to be more sensitive to the mold and the Lyme and some of the other infectious agents that eat up the brain. Here's just a couple of little risks here of what people, some of the current statistics with the ApoE44. some studies say 90% of those people are going to have Alzheimer's. And so again, we have to just keep assuring our patients that they have control of this and that it's not inevitable for them to develop Alzheimer's. So the bottom line, again, over and over, it's preventable and it's treatable if we can find and correct the underlying causes. So let me just say a little bit about Alzheimer's. It's one of many types of dementia. Dementia is kind of an umbrella term for all kinds of neurodegenerative disorders. Alzheimer's itself is characterized by development of amyloid plaques and neurofibrillary tangles in the brain. The amyloid plaques are called beta amyloid, or some people say A beta, and then with the neurofibrillary it's called tau beta. Dementia tends to be progressive, and it kind of starts out slowly and then, can speed up as more and more neurons die. Typically with Alzheimer's, people say that there's a sort of a 10-year progression with the classic later onset Alzheimer's. But type 3 Alzheimer's, and I'm going to show you the types in a moment, that is from toxins and infections, that type tends to go quite rapidly. So the prevailing theory about Alzheimer's is that it's due to these amyloid plaques that are gumming up the brain. And amyloid is a sticky substance that develops in the brain when there's an insult to the brain. So when something hostile happens in the brain, the amyloid is secreted to kind of wall off that area and protect it. And so the thinking in all these years of clinical trials for Alzheimer's is, if we can get rid of the amyloid, we'll make the brain work better. And we have drugs that will get rid of all the amyloid, and I did all the trials with all the drugs that are out there, and we could do scans and show that we took the amyloid out of that person's brain, but they didn't get better. So that isn't the answer, and taking a medication to just fix it isn't the answer. So our treatment goal has to be to figure out what is attacking the brain and stop that downstream. So I think a lot of you here have heard of the Bredesen protocol and perhaps read Dale Bredeson's new book, The End of Alzheimer's. I've had the great fortune to work with him over the last year, and we're working on designing a prospective clinical trial using his method. He is a neurology researcher and somehow came to the conclusions that a functional medicine approach was the way to treat Alzheimer's. And his approach is pretty much what I did on myself, is work through all the layers. So in our clinical trial, we're planning to enroll 50 patients. We've been working on it a year. We're getting pretty close to being ready to launch, but we're going to have 25 patients that are going to go through a functional medicine approach to reversing dementia. We'll have another 25 patients that are going to have a traditional standard of care, which is going to be to take Aricept, one of the drugs that can perhaps slow things down for up to a year, but doesn't reverse anything. And then we're going to allow the people who are in that particular treatment arm to come into the active treatment that we think will help them. Okay, so Dr. Bredesen talks about 6 different types of Alzheimer's, and here they are. And type 1 is an inflammatory type, and this often happens in people that have ApoE4 because, as I mentioned, it's an inflammatory gene. We often see increased insulin, hemoglobin A1C, fasting glucose, metabolic syndrome, insulin resistance in people with this kind of picture. The homocysteine can be increased, the inflammatory markers, the CRP, the IL-6, the TNF-alpha, problems with the lipids, might see AFib. Often people that are inflamed tend to eat an inflammatory diet and have a leaky gut. And in this type, people will have trouble with recent memory, but their long-term memory can be preserved. Let's see, where am I? Type 2 is the atrophic type. And basically, something that's trophic supports life. And for our bodies and our brains, hormones are one of the important things that are trophic for our bodies. So the atrophic type is lack of hormone support. And this is something that happens to all women when they, cross over through menopause. And then some of the other vitamins that are really more like hormones, vitamin D, vitamin B12, deficiencies of all these things can cause this type. And I'll say some more about that later. Type 1.5 is between type 1 and type 2, and meaning it has features of both. Type 3 is the toxic type. And I put SIRS in parentheses. Maybe you don't all know about that, but that's chronic inflammatory response syndrome. And that is a syndrome that happens when we have biotoxin illness from Lyme and the co-infections from mold and the mycotoxins. And there's a big inflammatory cascade that happens, and it infects, they both can affect the brain quite dramatically and affect many of the hormones in the brain. This type looks different. So because of all that, the brain involvement, it's not a particular area, but there's kind of diffuse brain involvement. And it can present similar to traumatic brain injury. So the whole HPA axis gets dysregulated. So the parts of the pituitary and the hypothalamus that are directing our hormones get out of whack, and they're just not functioning properly. So we see a lot of hormonal problems, mood problems, depression, anxiety. And people with type 3, in the beginning with traditional kind of Alzheimer's, people will have trouble with their recent memory, but the memories of the past are pretty well preserved in the beginning. But with type 3, even the remote memories are gone. And another dramatic thing that we see sometimes with this is speech problems. I first learned about this with one of my friends who was quite ill, first with Lyme and then with mold. And each time she got sick, she couldn't speak. She would have this really and she could not get the words out. And since then, I've definitely seen patients with that speech problem, and it definitely clues me in to look for infections that are affecting the brain. This type also has problems with math. They suddenly can't calculate a tip, sometimes problems with spelling, reading. So multiple areas of the brain, not just the hippocampus, which is the memory centers. And this can often be precipitated by stress. So it's confusing. It can get blamed on depression, because what's happening is these infections have a kind of an insidious effect on the brain, and then suddenly something stressful can just be the straw that broke the camel's back. But what happens is then some of these people aren't getting on the right treatment paths because they're told this is a psychiatric problem. This is why I see many, many people with that. Vascular dementia is a type of dementia that is in some ways a non-Alzheimer's. It's the second most common cause of dementia besides Alzheimer's dementia, which again I think is a mixed bag of things. But vascular is people that have had problems with lipids and diabetes and hypertension, and then they can have multi-infarct dementia or little tiny areas of damage in the brain. And the final type is the traumatic, and this is head trauma. And now we have information that even very minor head traumas, even playing soccer with a soccer ball on your head, minor things can translate to problems down the road. And the ApoE4 carriers have a higher risk for developing dementia after a traumatic brain injury. Some people say a 10 times higher risk. So these types they're artificial, and they're useful to think about, okay, what are some of these various causes that we need to be thinking about as we're working people up for cognitive problems. But the reality is it's almost never any one thing. It's a combination of those things. One of the things that Dr. Bredesen is often fond of saying is, if your roof has 36 holes in it and it's leaking, and you fix 30 of those holes, the roof is still going to be leaking. So really it's our job to be detectives and look under every rock and try to look at every cause possible. I want to tell you about a new subtype, and this is kind of some hot off the press stuff that one of the reasons I was down to the wire finishing my talk was going through some of this information. But in our dementia study group, we had a session with with Dr. Ari Vajjani a couple of nights ago, and he gave us some amazing hot-off-the-press information. And he said after he went to the IFM meeting this past year on the brain, he started thinking a lot about antibodies in the brain. And what he decided to do was to make a monoclonal antibody for amyloid. So remember I told you amyloid is the stuff that gums up the brain when we have trauma in the brain. So he made a monoclonal antibody to amyloid, and he said, wonder what reacts with this. And what he found out, and he tested all kinds of things, and he has many, many panels in the Cyrex labs to test various things, but he found that these three things cross-react with amyloid, and that certain foods, certain toxins, and certain pathogens or infections. So I wrote with him and just got this information. He tested 180 foods, and these are the only 8 foods that cross-reacted with amyloid. So it doesn't mean if you're allergic to foods and you're eating them that you're not going to have autoimmune problems that create inflammation and eat up your gut and then eat up your brain. But these particular foods were ones that strongly reacted. And he told me the canned tuna was so different than the raw tuna. He said raw tuna had no reaction, and they kind of graded like 1 to 4. And he said raw tuna was a 1, but canned tuna was a 4.
So these are mainly GMO foods. Those are mainly processed food. So if the tested media is wheat, but we don't know if it's GMO or non-GMO.
Well, that's an interesting question. Yeah,
right.
And I will ask him.
Any allergy tests I send out, I always, this is one of the things. When the test media is they're allergic to eggs, what type of eggs?
Yeah. So it's an interesting question in general for the Cyrex panel.
So many protein shakes.
What's that?
So many protein shakes.
Protein shakes.
Pea protein.
Yeah, pea protein. Oh, no, I mean, I recommend pea protein frequently. There's a good...
Backdrop from recommending it?
Well, this is literally this weekend. I got this information yesterday, so I'm trying to assimilate it. But I've spent the last 24 hours trying to put things together so I could share this with you because it's very exciting information. These are the toxins that he found was a problem: aluminum, plasticizers, and phthalates. And, the aluminum, of course, it's been bandied around. Aluminum causes Alzheimer's. It doesn't cause Alzheimer's. And, I think this doesn't matter whether it causes or not. The point is, if you have aluminum in your brain and you develop antibodies to amyloid, they are going to attack the aluminum that's there in the brain. These were some of the pathogens. He rattled these off, and I'm going to be meeting with him next week, and hopefully I can get some more complete lists. But Borrelia, which is Lyme disease, definitely cross-reacts with amyloid, no surprise. Herpes viruses, no surprise. In autopsy studies with Alzheimer's, something like 99% of people have herpes viruses in their brain. Epstein-Barr virus, West Nile virus, E. coli, and he just said more. So that's what I got from that. So this is the important thing. If you have antibodies in your blood and they're not crossing over into your brain, then you're not going to be in trouble. You might have some inflammation in your body, but it's not going to be eating up your brain. So the important thing is to keep the blood-brain barrier intact to prevent these antibodies from getting into your brain. And I think most of you either work in or are interested in functional medicine. And of course, we know it all starts with the gut. That's the root of our immune system. And if we don't have a healthy gut and if we don't have an intact gut lining, then everything's getting through into our blood and activating our immune system. So starting with the gut is where we all start. And that's how we help our brain. These are some nutrients that Dr. Vajjani said he found research on to support the integrity of the blood-brain barrier, and I think you're all probably familiar with all of these as potent antioxidants. And then, of course, exercise is well known for the effects on the immune system and the brain. And I added, for my patients that have signs of autoimmunity, I would consider adding low-dose naltrexone to that picture. Naltrexone, LDN, low-dose naltrexone. That's a talk in itself, but just thought I'd mention it. So this is my basic dementia protocol in a nutshell. And the first thing, of course, is investigate. Find out what are all these factors. And that does translate to a lot of testing. And that's sometimes that's the hardest part for me of the protocol is there's so much testing that needs to be done. And, I can't order all these labs in one or even two sittings because there's so many labs that I order. And then there's specialty testing, looking for toxins, looking for metals, all kind of things that it takes a while. But it's really important, more so than in any other population, that we look at every one of those things because we need to get them all in balance to fix the brain. The diet is an important thing, and I mentioned the gut, and of course we need to eat an anti-inflammatory diet. When you're having cognitive problems, by definition, your gut is going to be a mess. You're stressed, you're trying to maintain, your spouse is stressed. It's not a good condition, so you can just assume that these are people who need to work with their diet and work with their gut. There's increasing amounts of data coming out with ketogenic diets, and they're not for everyone, and I don't start all my patients on a ketogenic diet in the first visit. Some are already eating pretty clean and can go there, and some can't. But what we do see clinically is sometimes very quickly, in a matter of days, when people start a ketogenic diet, that the ketones really heighten the brain clarity, and it can make quite a difference for people. And I think I'll say a little bit more about that diet a little further on in another slide. Exercise is critical, and what we found is all of these factors are critical. So it's like a full-time job for people to do this protocol, and you have to kind of grade in, the steps that people can take on and incorporate. But what we find is when people do all of everything together, that's when they heal. And when they say, "No, I've never exercised. I'm not going to exercise," you're kind of climbing uphill with that. But exercise, it's the strongest data we have for brain and cognition is exercise and meditation or mindfulness. That data is clear as clear. So mindfulness, meditation, Tai Chi, Qigong, guided meditation, heart math. I try to figure out what works for what patient and what can they do, but doing something to shut off their brain and come into their body. And I'd have people say, look, you could do 5 minutes when you wake up, 5 minutes when you go to bed, 5 minutes in the middle of the day. It doesn't have to be all at once, but definitely nice data for the brain with that. The brain training is also very important, and as we start, finding the provocation for what is causing dementia, we have to try to work with the neuroplasticity. So the exercise, the mindfulness, and the brain training are all facets of that. And we really like the Brain HQ program. It's inexpensive. You pay an annual fee. You can put it on your cell phone and your laptop. And I tell my patients, okay, if I'm running late, do your Brain HQ while you're waiting 10 minutes here. But they have a lot of nice outcome data on their brain training programs, and they have specific. You can do a general thing where it grades where you are, and it keeps making it harder as you get better. But they also have specific courses for different problems. So when I do testing with my patients and I see a particular area in their neuropsych testing that needs more attention, I can look at the Brain HQ and find a particular exercise that might be good for them to do more often. And sleep, I think I'll say a little bit later a little more about sleep, but definitely the sleep is so important for people here. And then supplements are part of the program based on all of the things that we turn up, and of course optimizing the hormones. So this is in your handouts, and I'm not going to read all these to you. I spent a lot of time trying to put ideas in the handouts because there is, and it's not everything, but it gives you some great ideas to get started. But looking at all of the factors, with lipids and blood sugar and nutrients and B12 and vitamin D and all of the sex hormones and all of the thyroid hormones. There's missing an I on my infections. There's a lot of testing for infections that needs to happen. You just cannot assume that they're not there. And that's probably a lecture in and of itself of how to test all of those things, but it gives you some ideas. The genetics, it is helpful for knowing how aggressive and to be, especially with regard to their lipids, with the ApoE4, the methylation genes, the MTHFR. Sometimes looking at detoxification genes becomes important because we do test the chemical toxins, we test the heavy metals. I'll show you at the end of the slides one of my patients with the toxin testing that we weren't really finding anything clear except for a little bit of vascular problems, and she came into me already very demented. So definitely our goal is to help people before they get really demented, because then you're swimming too far upstream. But I always think it's worth trying, and I definitely feel like even if people are far along, we don't know, but it's this is a person who we want to try to help, and we have no guarantees, but it's always worth trying. And in her case, I had stopped her from declining the last 2 years, and she was declining steadily before that. But I'll show you her toxins, and that was my bingo of one of the things that was really eating up her brain. The HLA-DRDQ is a genetic testing looking at the HLA haplotypes that tell us who is sensitive to mold and who is sensitive to Lyme. It's not 100% reliable. I can have people very sick with Lyme or mold that don't have that haplotype, and vice versa, but it still is helpful as part of a pattern recognition. Obviously, stool analysis, I do that first visit all my patients. That's where I always start. Marcons is a nasal swab testing that we do in the nose for people that are exposed to mold or when we're concerned about mycotoxins. Whatever happens in your nose goes right to your brain. I think that's a really important point to make. And many of the medications that we're using, working with dementia, working with mold, Lyme, we use in the nose because there's this little small cribriform plate up in our nose that connects with our brain, and there's little holes in that cribriform plate. It's porous. And so anything happening here and from an infection standpoint, it's going to your brain. Dental problems, gum disease, or infected teeth, or root canals that you think are okay and maybe aren't. Those all have implications for our brain and our brain health. Sleep apnea is critical, and I test all of my cognitive patients for sleep apnea. I've found it in little tiny women that aren't overweight, so it's very important to test that because it's a huge correlation with dementia. I mean, you're killing brain cells every night if you're not getting enough oxygen to your brain. And then we're also doing volumetric MRI readings. It's a little bit complicated because I send people for the MRIs with the instructions on how to do it, and 3/4 of the time they aren't done properly. But when we get it right, it's a very useful modality. So we ask the MRI technician to take extra slices in the pictures that they're doing in the brain, and then we run it through either a NeuroQuant or a NeuroReader program, and they have an algorithm that then will tell us the size of all of the structures of the brain. And so we can see what percentage is your hippocampus. Uh-oh, it's down in the bottom 3%. You're in trouble, right? I mean, 50% is average. But the good news is that when we work with people in this functional method, we actually see those brain volumes change and come back. And that's the really exciting thing. So it's kind of worthwhile the hassle. I'm trying to, figure out how to work better with the MRI centers to make it easier, because it is a hassle to say, okay, you did the MRI wrong, and they don't want to redo it, even though I ordered it that way. But it's a useful thing. Some more of the labs, some of the mold labs that I look at, and again, it's a whole lecture in of itself to say, how do you interpret these, because it's a pattern recognition. It's not any one thing that tells us that somebody is being affected by mold or by Lyme, but many of these are neurohormones, and they get out of whack when your brain is being involved. Did you have a question?
Yeah, just the Quest reinstate the C4A, because my understanding was Jewish National wasn't offering that anymore.
National Jewish does do it, but Quest doesn't do it. Quest will still send it to National Jewish, but they will not draw it because it has to be put on dry ice right away. So for those of us in this area that are able to use the OMI draw stations, they will do it. But Open Medicine Institute. So if you're here in this area, they have one in Mountain View by the hospital. We have one in Lafayette, Walnut Creek, San Rafael, Mill Valley. I think that's all of them. But they're a draw station that can draw multiple labs at once. No, it started with the one in Mountain View, but they made different draw stations. And so they're useful when I have somebody that needs to get Quest done and LabCorp done, because some of these labs are only available at one or the other, or maybe they're available at the other, but they don't do it properly. So that's the current thinking right now. For the HLA score, when you do the HLA, you get a bunch of gobbledygook, and you can learn how to interpret it, or you can just go to myhousemakesmesick.com, put in what you're seeing in the gobbledygook, and they will tell you what is your sensitivity to Lyme and mold from that. It's a shortcut. So I have my staff do that. For the neuropsych testing, and it's very important to get a baseline on, where is somebody, and something that you can track over time. Used to be we all did the many mental status exam, but these days the standard seems to be the MOCA, the Montreal Cognitive Assessment. So I put the link, and you can, print that out, and they have instructions on how to do it. It can take 5 to 15 minutes, depending on how impaired your patient is. CNS vital signs is something that I have been using lately, and it's an online neuropsych battery, and it's excellent. It's a 30-minute neuropsych battery. They cover all the domains that people do in a full day of neuropsych testing. That you have to spend a couple $1,000s and a whole day of feeling inadequate, because I'll tell you, this is so hard on people, and I have to psych them up for it and put them back together after they do it, because when you're suffering and then you have to take a test that you used to be able to do these things and you suddenly can't do them, is emotionally devastating. So, but it's a very useful test. It's inexpensive. And it's something that you sign up and you put on your computer, and then the patient takes the test on the computer and immediately gives us the results in a chart with all the different domains of neuropsych functioning. And then I'm able to give them a CPT code billing, that they can submit for their insurance. A couple other testing modalities that I use with the mold people, the visual contrast sensitivity testing. When people are being affected by mycotoxins, it affects their ability to the discrimination in their eye. You don't notice that you can't see, but your contrast discrimination can be impaired. So we sometimes follow that. And I've seen people, when I get them out of a moldy environment, their VCS gets better. Then they do remediation and it isn't done fully, and they go back and it gets worse again. So that's something useful to test. And then the home mold testing that many of us use is there, and it's a good first pass when you are suspicious to have somebody do this home mold testing. And what I've learned from working and talking with many mold inspectors is you can order a vacuum canister, or you can order a Swiffer dust cloth. And we advise people to get the Swiffer dust cloth, and then I tell them fold that dust cloth in quarters and collect all the dust in 1/4 of the cloth, because the way they analyze it is they vacuum up that dust and then they do PCR testing. So if it's concentrated, they're going to get more of the dust off. And you have people collect dust in their house. If they see any mold, they should not put the Swiffer dust cloth in the mold, because that's all that's going to grow. But I'll tell people, if you have mold in a room, definitely collect in that room, just not from the mold. And you can collect on the wall. You can collect on the back of things, the baseboards, but underneath beds. And I just have people collect all over their house to get a general index of what is happening in their house. Not all kinds of mold are dangerous, and some people don't get sick with mold. 75% of people don't. But then there's a scoring that we use, and we convert this to a Hertzme score that kind of tells us, is that house safe? Is it borderline? Is it dangerous? And that same free website, My House Makes Me Sick, you can go to that and put in those scores, and they'll tell you. Okay. Let's see what else. I had something else to say before I showed you those pictures there. Oh, I have a few just more details that aren't on the slides, but things that I wanted to say a little bit more of. Just as far as the protocol and some of those steps, maybe I'll back up to the steps of the protocol. This one. Okay, so just a little bit more about the diet. I suspect we're all in agreement on a healthy diet. There is no one size fits all, and I definitely don't think all patients can be on a ketogenic diet. But it's definitely been quite helpful for cognition. So for people who don't know what a ketogenic diet is, it means that you restrict your carbs to a point where there's no more sugar for your body to burn as fuel. So our body can burn sugar for fuel, or it can burn fat as fuel. And somehow when we're getting into that fat burning as fuel, the ketone bodies that are generated by the liver cross the blood-brain barrier, and they really heighten the thinking and the clarity of the brain. People are now doing studies with ADHD with a ketogenic diet, and I definitely have some of my ADHD patients telling me that it's helpful. We've known for a long time, almost a century, that from working with the children with seizures, that when kids have intractable seizures and they put them on a strict ketogenic diet, they can stop seizures that no medications were stopping. So clearly there's a precedent for effects on the brain. So what we do is in general, we ask people to restrict their carbs to less than 50 grams a day. And sometimes people have to restrict it more, but usually for most people that seems to work. And for these carbs, it's net carbs. So fiber doesn't count in your carbs. So I have a favorite snack that's called Flackers, and they're these flax crackers. And it's just flax and sea salt and rosemary. And when you look at it, it says there's 7 grams of carbs, but there's 6 grams of fiber. So the way you would calculate the grams of carbs is you'd say, okay, total carbs is 7 minus the fiber 6, the net carbs is 1. So you could eat those crackers and it's only 1 gram of carbs, so that's very low carb. So you can, if you're eating a high fiber food, then it won't count as your carbs, and it does help to fill you up. But we love the high fiber anyway because of the data with all the people like the Hazda tribe in Africa. They don't have any chronic diseases. They don't have Alzheimer's. They don't have hypertension. They don't have diabetes. They don't have arthritis. And what people have discovered is that they have the most diverse microbiome in the world. And the diversity in their microbiome is because of all the fiber they eat. So fiber is a prebiotic, and that feeds our probiotics. And, when I first started in functional medicine, we used to put everybody on probiotics, and there's a role for that, and I use them, but I don't put people on them chronically for everything anymore. I just, get them better and try to have them do it through their food the way it's meant to be and eat lots of prebiotic foods. So, shifting people into this high fiber diet is helpful. But we have to watch it. Some of our people are older and they're not overweight, and many people that need to lose weight, a ketogenic diet is great because they start dropping a lot of weight. But I have to watch my people that don't need to lose any weight, and you have to be sure that people are eating adequate amounts of fat because it is a high fat diet. So you can't just cut out your carbs and your sugar and not up your fat content, or you'll be in trouble. You'll be tired. You won't have any fuel for your body to run on. One of the things that we use to help get into ketosis and help the brain is MCT oil or coconut oil. MCT oil is medium chain triglycerides, and you have to watch it when you buy MCT oil and check that it is all medium chain triglyceride, because sometimes they'll add in some of the longer chain, like the palm oil, and they'll cut it with some of that because it's cheaper. So you want the pure MCT oil because that's what's going to go straight into making these ketone bodies. And when people start the MCT oil, there's lots of anecdotal stuff and maybe some studies coming out of people that really do so much better cognitively when they start. There was a pediatrician who said she started feeding her husband 8 tablespoons of coconut oil a day, and it reversed much of his Alzheimer's. And so that's the whole idea. It's easier to take some MCT oil than to eat tablespoons of coconut oil. Though I have some people that do, and they think it's fine. But the MCT oil is a laxative, and so you have to warn people, start low, go slow, and only take it after you eat. So if you take it on an empty stomach or your digestive enzymes haven't woken up, you can get severe cramps, you can get severe diarrhea, and I can vouch for that because I did it once. I lost a whole afternoon with that. So I always warn my patients, start low and take it after food. I have people start with like a teaspoon and then work themselves up to a tablespoon. And we know that 2 tablespoons a day really can produce some massive amounts of ketone to really have an effect on the brain function. But when you want it for a therapeutic situation like a dementia, go up to 3 to 5 tablespoons a day is a good thing. The one thing to watch for with the ApoE4s is that fat bucket gene. So they tend to store all their fats, and you do have to watch their lipids. We want the cholesterol is great. We want the cholesterol to be high, and we want the cholesterol. Optimal cholesterol turns out to be 224, 225. Cholesterol is a precursor to all of your hormones, your sex hormones, your stress hormones, your thyroid hormones, and your brain. All that squishy stuff in your brain is fat, and it comes from cholesterol. And so when people take their cholesterol too low, that's a huge problem for the brain. And that turns out to be one of the big factors in my dementia. There were, several, of course, but I always had a cholesterol of 135. And I grew up in the low-fat era, right? As people say now, is the biggest medical mistake ever. This whole thing of that low-fat was the right way to eat. And so I ate low-fat, and I didn't really like fat, so it was easy for me to do that. And I always thought, oh, I'm not going to have heart disease. My cholesterol is 135. Well, what did I get? Dementia. What would you take? Give me the heart disease, right? So I changed my diet once I learned what I learned, and I started eating high-fat at every meal, and I drove my cholesterol up above 200, and that was one of the ways that I got my brain to come back online, is to have the cholesterol. And some of my toughest patients psychiatrically are people with very low cholesterols, and trying to get those cholesterols up because it's too low to support the brain function.
Do you happen to be an ApoE2?
What is that?
Are you ApoE2?
I'm a 3. I'm a 3-3.
I have a kind of lower LDL. I'm a 2-3.
Yeah.
2-3 acts like a 2, right?
It's intermediate. They think they're kind of in between, that they sort of offset a little. Yeah.
This may be too much of a tangent, but I'm just curious, what do you do with your people who have like the familial hypercholesterolemia, ApoE4, they're already in the 400s, are they still ketogenic and MCT?
I probably would not do ketogenic with somebody with cholesterol like that. No. And that's why I'm saying, even the ones, and I don't have any, knock on wood, that are like that. Sounds like you do.
Yeah.
But even if I feel like there's some issues with their lipids, if we decide to try ketogenic, I will keep an eye on those lipids, and you will sometimes see them come up. And again, you have to interpret the whole picture. If are they the big fluffy LDL, then maybe it's not so bad. Do they not have the brain freeze, the worst one?
Oh, yeah,
The LP little a, Right, so, it's kind of a balance, but so that is my caveat, especially with the ketogenic. If people are already really out of control in their lipids, I wouldn't do it, And then, as I said, watch for the cachexia and the weight loss. Make sure they're really increasing their fat, and add supplemental protein as well. But I often added pea protein, so I have to know more about that.
I rotate protein.
Which one?
I rotate protein.
You rotate kinds of protein, yeah. I have some people do the paleo proteins, but they're flavored, and so.
No, I mean I presume everyone has a little bit of permeability, so
Yeah.
I have them rotate the meat. So 1
Yeah.
week pork, 1 week
That makes
white,
sense.
poultry, duck, chicken, and 1 week bison, beef.
So you rotate a week at a
just
time with
at a
each
time.
different
no
sort?
No eggs in the beginning.
Yeah, exactly. Finding the causal factors. I think I've alluded to some of these, but the chemicals, the metals, the dental exposures end up being huge for people. Those kind of hidden sources of infection that people can have in their root canals and they don't know. I do send my patients with root canals. I try to send them to get a cone beam X-ray to look at the integrity of those root canals. And I've definitely known and seen people that have severe chronic fatigue, and they pull their root canal and bang, they're better overnight. So it's it's not easy, and it's costly if you've got to pull your root canals and have a crown and all of the stuff involved with that. But it can be critical for neurodegeneration if there is an infection going on there. And beyond the people with you have a root canal because you have an infection in the roots, but there's all these microtubules that connect to your root. And so you can get this sort of subclinical infection in there, and your root is dead, so you don't feel it. But it's enough to turn on your immune system, and that can gnaw at things and cause problems.
Does that affect the wisdom teeth after they're pulled too?
I don't know. I think once they're gone, they've taken out all the roots, and so. But I think sometimes when people get the cavitations and an infection after a surgery, of course, then that's a time to be aggressive. So it's the dental stuff it's overwhelming for people because it's so nebulous to not know, but it's really hard to know who really needs to go that route. I have personally done the cone beam X-rays twice on mine. When I was very sick, I did it, and I do have a couple of root canals, and saw. Up at the office in Santa Rosa, Mary Ellen Chalmers was one of our teachers at IFM. She teaches a detox module, and so she's been working with this for years. And her husband, who's now retired, was an endodontist, so he knew how to evaluate that. And but the more and more people now have cone beams, and they've come down quite a bit in price. And then if you have a patient do that, you want to have the person doing it send it to they're called beam readers, and those are the radiologists that are trained to read. And they know what to look for in the integrity of the root, and they look for anything, a diffuseness, and the root should be a strong line. And if it starts to get diffuse, it's a sign of infection in there. So, but it's dependent on the radiologist telling you what you're looking at. Medications, when we're trying to find the causes, statins, that's a giant cause, and we now know they have black box warnings for cognitive decline, and the problem is it's driving the cholesterol too low, and it's not enough to support people's brains, and I've seen that happen over and over. Proton pump inhibitors, anticholinergic meds that are often given out like candy to elderly, and they cause confusion in the elderly, and they cause confusion because they're affecting the brain. So drugs for urinary incontinence, muscle relaxers, antihistamines. There's data now with gabapentin, Neurontin, that also is given out like candy. It has cognitive decline. Topamax, another anticonvulsant that's used for pain syndromes, has always been called Dopamax because it can make you acutely very stupid. Well, what is that doing long term to your brain if you're going to take something like that? So we have to find alternatives, and I also find so many. As you look at the excipients in these medications, when I have somebody that has to take 5 or 6 medications, and then you look at all of the toxic excipients and the food dyes and the propylene glycol, there's just so much stuff in them that I'm constantly trying to get things compounded for people, but I feel like that's half of the driver of the inflammation are these prescription meds. And we need the meds. Why do we need those horrible toxic excipients? The sleep apnea I mentioned, nutritional deficiencies are huge with dementia. Certainly the easy low-hanging fruit is B12 and vitamin D. Very clear data. If your vitamin D is less than 30, you have a 75% increased risk for dementia. And if it's less than 20, you have a 125% increased risk. And, we live too far north here to get enough vitamin D. I've had 2 patients out of, hundreds and hundreds and hundreds of people tested over the last 4 years that had adequate vitamin D. One was a swimming instructor who lived in San Diego, and she was in the water all day, every day in San Diego, and she told me in the winter she had to supplement. And the other person had some kind of genetic mutation that she had a very high vitamin D, and nobody knew why. But other than that, Anybody not supplementing vitamin D is going to be deficient. B12 has always long been known as a cause of dementia, and as people age, they're making less hydrochloric acid, they're not absorbing their nutrients. It's so easy to be deficient. So if you don't look for those things, you won't find them. Omega-3 fatty acids, again, huge for the brain, the fish oil. It's easy to test. You can test that at Quest and LabCorp now. You can just order omega-3 fatty acids and get those profiles, the methylation genetics, the minerals, the zinc, magnesium, copper, and then iron. All of those things are critical for the brain. The B vitamins, the vitamin C, glutathione, NAC, the mitochondrial nutrients. I think I put something in your handout at the end just with some suggested like basic nutrients. And anybody with a neurodegenerative disorder, their mitochondria are under siege and under stress, and you need to support the mitochondria. And so some of the mitochondrial nutrients like the CoQ10, the lipoic acid, the acetyl L-carnitine, there's lots and lots of studies that show the effects of those things on the brain. I talked to you about the cholesterol, the hormones. Let me say a little bit about hormones. Let me look at my time. I could talk all night. Hormones, your brain is full of hormone receptors. Men and women have receptors for estrogen, testosterone, progesterone, pregnenolone, DHEA. We have all those receptors in our brain. And so when you stop making hormones, and they can be disrupted at any time. I have a whole cohort of 20-year-old guys on testosterone because they have no testosterone because they have Lyme or they have mold, which is disrupting their HPA axis, and they have no testosterone. They're at the level of an 85-year-old man. So you can have dementia at any age. I see lots of it from these brain infections. But the hormones are just a key player, and that is something that's so easy to help somebody get in balance. And if you don't work with them, just send them to somebody who does. And you can easily measure all these things from Quest and LabCorp on their insurance. If they have Kaiser, you can beg for certain ones, but they're worth checking, and every single one of them, putting them into balance. So the pregnenolone is the mother hormone, and that's the hormone that makes every other hormone in the cascade of the sex hormones and the stress hormones. And so that's for some reason it's a supplement. You can look at the level. I never give hormones, even supplements, without knowing the level and following the level, because you can overshoot it, and too much is not good either. So we need to have those in the right level. But I can start a woman who's been 20 years postmenopausal, no hormones, having neurodegeneration, and you can see within like 4 or 5 days major improvement in their cognition. And conversely, the other way around, when you stop these hormones, you'll see it quickly. So I first learned about this when I was doing my long-term clinical trials, and I didn't know anything about hormones, and I was a psychiatrist. And I had 2 different women who were in the trials, and their doctors said, you don't need your hormones anymore, you're old, you're demented, you don't need them, go ahead and stop them. And they'd come in, which, that's a reasonable thing from the traditional medical approach, okay, once you pass the transition, you don't need them. But they would come in the next month, and they came in every month for assessment and testing, and they'd say, this was a really bad month. And my memory's so much worse. And I could see it in talking to them. I tested them, and I could see it. And I said, please go back to your doctor and tell him you need to be back on those hormones. So that was my first, learning about that. But now I have dozens and dozens of studies in my functional medicine files about the effects of hormones on the brain. And there was a really fascinating study that a psychiatrist at Stanford did a couple years ago, Natalie Razgon, and they took patients that were on hormones and they randomized them either to stay on them or stop them. And they followed them for 2 years. And at the end of 2 years, 100% of the women who stopped their hormones had neurodegeneration that they could see on the head scan. And when you see atrophy on the head scan, that's a little more than mild. So those hormones are trophic for the brain. We need them at all ages. I went to a talk last week that some friends of mine were doing on Lyme disease, and I stayed afterwards with the people that were hosting it and had a lovely conversation with some of their friends. They said, what can I do about my brain? And, we started talking about things, and the woman who was hosting, her 98-year-old mother was there. And at 10:30 at night, she drove herself back to Rossmore in her Porsche. Interesting lady. And she was so with it and so wonderful. But she said, wow, she goes, I took hormones all these years, and 2 years ago my doctor told me I didn't need it anymore when she was 96. And she said, you know, my memory definitely took a dive when I stopped my hormones. I said, please go back on them, you know. And so I feel like that's what saved her. She was so vital. And so the standard prevailing dogma in the GYN community is take the lowest amount for the shortest amount of time. Well, you know, the reason they do that is because they have a liability, because if you get cancer, you're going to say your hormones gave me cancer. And what we know is hormones don't cause cancer. Diet and lifestyle causes cancer. But if you have an estrogen-sensitive cancer, then the hormones could feed the cancer, but it will not cause it. So I just make sure that people have their baseline test, that they're clear. And even if they've had breast cancers, I have a pathologist that's an expert in that I have them consult with. And, you know, generally, you know, if things are clean, they say give them the hormones, because when women get breast cancer after menopause, it's not fun, but they typically don't die. The people that die from breast cancer are the aggressive ones that premenopausal women get. And so not that I would, you know, want anybody to get cancer, but when you have a choice, we have treatments for cancer. Until now, we haven't had treatments for dementia. So if you expect to use your brain all your life, keep those hormones balanced. It's a huge factor. Yeah.
So are you advocating that every woman over a certain age be on hormones?
I would, if they want to save their brain. I think the data is clear that the brain is going to atrophy without those hormones.
The devil's in the details, what kind and how much.
Absolutely. Yeah, well, that would be like a whole other talk, but you know what we know, if you give the estrogen transdermally through the skin, so a patch or a cream, it's going to avoid first pass metabolism in the liver, and so the oral estrogens, some of the, when they conjugated, and some of the metabolites were more likely to cause cancer, but taking it transdermally does not seem to do that. So that's one thing. The testosterone, there's different ways people will do the creams, they'll do the injections. Some people will do an alternate route using Clomid that sort of tricks the testicles to making the testosterone. Again, I'll often use that in the younger guys. But yeah, if you ask me, I mean, there's never one size fits all. You have to, investigate and make sure. Like if it's a man, I check the PSA level. If it's at all slightly, not even elevated, if it's creeping up there, I'd say go see the urologist to get a digital rectal exam, make sure everything's fine before I would want to give hormones. That if there was a cancer, I wouldn't want to feed it. So I don't say give it out like candy. I mean, do due diligence, but if you want to save your brain, I just see it over and over. To me, that's easy.
Just to comment, I'm a big advocate of balancing hormones, and I see a lot of, I was telling I work with athletes, so even they're young and stuff, their testosterone can be low, and balancing hormones definitely is a big part of wellness in all aspects, but not from outside source.
Yeah.
Healing the organ, healing our body to produce as much hormones, and understanding why that testosterone is low, why the estrogen is low. Because estrogen happens to be early riser, comes and takes all the parking lot, so it has all the receptors.
Right.
Can bond any receptors that progesterone or testosterone can bond. So increasing progesterone or testosterone, unless we balance the estrogen through adrenal glands, pituitary, hypothalamus.
I'm with you. You have to look at them all. There is a balance with all of them.
When we give extra estrogen, progesterone, then there is an HPA axis destruction.
Right.
So I'm not an advocate, and I've seen a lot of decline. At the first, it helps. Like as you said, couple months, they're like, ooh, progesterone is in, testosterone is in. But working with athletes, putting them on testosterone, even if it's bioidentical, it will cause other issues.
Right. Well, so there's a difference of the age groups too. So if you have somebody, because men do go through andropause just like women go through menopause. It's just it's not as precipitous. So somebody that's postmenopausal or postandropausal, that's going to be different, of course, than a younger athlete. And my younger men, my goal, I tell them, this is not that you're going to be staying on this, but these are people that are suffering, and when they can't read a book and they can't, function, and you watch their brains wake up, sometimes you need a Band-Aid when you're bleeding, but I totally agree with you that the goal, like with my young guys, I'm trying to get everything in balance and get them off of those kind of exogenous things.
Even with older patients,
Yeah.
like happening thyroid to be the conductor for all the hormonal balance.
Yeah.
And 60% of thyroid hormone being converted in liver and 20% in T3, activated in liver and 20% in gut.
Yeah.
Again, I go with even older patients, I address liver detox to boost adrenal issues, to boost testosterone. Understanding, because a lot of time through my testing, testicular testosterone production is very normal, even in different ages. Could it be prostate related? Could it be adrenal related, hypothalamus?
They're all related,
so
definitely.
Unless I figure out where is the chain to twist, I just personally have seen many different results with twisting one end.
And depending on the complexity of the illness, my gut instinct isn't to jump in younger people, and I want to try to correct things before I would go to that. But when I'm working with people with dementia, it's a totally different thing. I'm racing the clock because their brain is degenerating. And so I feel the need to do everything I can as fast as I can, but I definitely feel 100% postmenopausal, if you want to save your brain, that you do need to replace the hormones. And the data is very clear. I spent a day last month, one day training on traumatic brain injury with Mark Gordon, who's a TBI expert. And he presented the most amazing cases of, veterans that had major head trauma with explosives and the like, that, it destroyed their brain. They suddenly were beating their wives and they were psychotic and PTSD. And the way he cured all of his cases, and he had the horrific cases, was hormones. And because they had the head trauma, the HPA axis was disrupted. And so with the less sick people, like even with the athletes, if they're over exercising, that can disrupt their HPA axis, but that's fixable, right? But these are people, they've had head trauma, and the way he fixed these cases was he took every single hormone and he put them all, and he's more aggressive, he put them at sort of the top of the range with everything, and he presented case after case where they got off of psychiatric medications, where they saved their marriage, they saved their lives, and it was through regulating those hormones because their brain could no longer regulate them.
I completely agree with when they're in like extensive psychiatric conditions, or they are on psychiatric medication. That's much better alternative than suffering the consequences of the
exactly. So I'm not saying for people with a different level of illness, but for saving your brain, yes.
Generally for women.
I just had a couple more points, and then I'm going to stop. Sleep. We know now about the glymphatics, which are our detoxifying system, our lymph in our brain that happens while we sleep, and this is why the notion of we actually really need adequate amount of sleep. I'm somebody who certainly, when I was younger, could go without sleep, and boy, now I feel it when I don't, and you see the explanation. But those glymphatics, when we're sleeping, it turns out that the brain matter shrinks and the synaptic connections shrivel down to make space for the cerebrospinal fluid and the lymph in there to start churning around, and it literally is like a washing machine, and it cleans out our toxins every night. So if we're a couple nights out of the week not getting enough sleep, we're not detoxifying, and that has to be considered. The blue light blocking glasses, new stuff coming out with that, and I just found a new brand that they actually have data. They have more sophisticated than the $8 ones that I bought on Amazon, and showing that if you are blocking the light, they have one pair of glasses that you wear at twilight and then another one that you wear later in the evening, and they show that there's like 6 times more melatonin, because when we have all this light from our computers and our cell phones, and I'm so guilty of that, it does wake our brains up. I can work all night on my computer. If I start working too late at night, it wakes me up and I'll keep going. The exercise is some of our best validated data for cognitive improvement. We know it increases BDNF, the brain-derived neurotrophic factor, and that BDNF makes new connections in our brain, and it only takes 4 minutes of intense exercise to have a surge in your BDNF. And there's a lot of lovely data coming out now with the interval training. And they have it down to 1 minute of intense exercise. A 1-minute burst causes this whole cascade of things that helps your lipids and your inflammation and your brain. So while my cardiology teacher in functional medicine is still hardcore, he says an hour a day, 40 minutes of strength training and 20 minutes of cardio in that order. And that's how he gets people with bypass off of all their medications. But even, short amount of exercise can help. And I tell my patients every day, you have to exercise every day. And then if you miss one day, you're okay. But if you, I ask people, how many times a week do you exercise? How long? Oh, 3 times a week or 4 times a week. Something's going to happen. You're going to miss one of those. Then you're down to 2 times a week? No. I mean, after a certain age, your body needs to exercise every day. Of course, so do our kids. The stress reduction is the same, daily practices, and it can be 5-minute chunks of time. They don't have to, sit in a lotus position for 20 minutes. I tell people there's a lot of great guided meditations that are free on the cell phone. And, just turn on that guided meditation while you're brushing your teeth at night and, getting ready for bed. Sometimes I have a choice. Okay, I could meditate or I could exercise. Well, why don't I turn on the guided meditation while I do my Pilates reformer, and okay, I get benefit. It's like you're coming into your body and you're shutting off your mind, and we have really, really nice data for that. Let's see, we talked about the brain HQ and sort of just one little topic about the emotional and there's so much support that's needed when people are having cognitive decline, and particularly the spouse or the significant other. Many things get put on their shoulders because their loved one can't handle things that they used to, and it's a really difficult time. I mean, so much work and support needs to be done with both people and all the issues of staying connected with people, because there's a tendency, when your brain is degenerating to just you don't want to talk to people. You can't track the conversations, but lack of those social connections and connectedness causes the brain to degenerate further. I want to just show you one thing before we stop, and this is, where did I put it? This is one of my patients, the one that I mentioned, who was she's probably the most demented patient that I tried. She was already in a memory center, and we had, we stopped all of her skin picking and her agitation, and it turns out, as her daughter told me on a thing last month, she goes, she has not declined at all in these 2 years that she worked with you, and she was declining before. So I take that as a success. She hasn't declined and she's happy, but I want to show you what her toxin testing looked like, because I really couldn't get she had some vascular issues, but and I corrected a lot of things, so obviously I've done some service, but this was a biggie. She has 7 things above the 95th percentile. There's 2 of them. 3, 4, 5, 6, 7. But look at that. And what from this test has just come out in the last year, and so but I've done enough of them that I'm starting to see things. And basically, if you have one thing above the 95th percentile, that's considered really relevant, and that you need to do some major detox. One thing in the red or 2 things in the yellow above the 75th percentile. So we've got 7 in the red and 2 more above the 75th percentile in this woman. She was a school teacher. Her daughter said, my parents were always into ELF. We ate clean. We didn't use toxic chemicals in our home. She is a poor detoxifier, unless they were spraying the heck out of her school where she taught all those years with chemicals. But, even then, it is our genetics. Some of us don't detoxify well, and, things will accumulate in our bodies, and other people can get exposed to a lot, and it doesn't bother them. But we certainly promptly tested her daughter who's my age, who also turned out to be fairly high on some things. So this is one of those things, if you don't look for it, you're not going to know. Unfortunately, she, in her circumstances, can't do major detoxification because the best data we have for helping things like this is saunas, doing daily saunas, like an hour a day. You have to start slow because some people get really sick with the sauna when they're toxic. But there's very nice data that does show that you can diminish these toxins through sweating.
Is that Great Plains Lab?
This is, yeah. Mm-hmm. Yeah.
Do you get the same effect with the Epsom salt baths as you do with the saunas and everything?
Well, I think it's maybe some different things. So the magnesium probably, and the Epsom salts is good. That's another good thing. I give my patients a list of things, and I say these are all things you can do for detoxification, including teas and foods and coffee enemas. And, there's many ways to detoxify: lymphatic drainage, jumping on a trampoline and getting your lymph system to move around. But the doing the heavy sweating is the idea. I went to a presentation at my Integrative Medicine for Mental Health meeting a few months ago, and Stephen Januous is a physician researcher up in Canada who researches and tracks and looks at these things and does outcome studies. And he said anything that makes you sweat is going to mobilize the toxins. So he said it doesn't matter if it's a near-infrared sauna or far-infrared. If you're sweating, it's going to come out. And so even if you take a hot bath or a hot tub, if you come out and it's raised your body temperature enough to have some sweating too, that will do it. But obviously a sauna is more intense. And the caveat is when you're mobilizing those toxins, you've got to be drying off, because if you leave them on your skin, they'll just reabsorb. So I tell people
Sweat huts of the Native American Indians, and they're always scraping the sweat off their skin.
Yes, because you need to take it off. So yeah, I tell people bring your towel in the sauna, keep toweling off, and then go immediately into the shower and wash it off so you don't reabsorb.
So actually, my experience with the sauna is this: when you start to release the toxins, and this is a question for you, and it's in your bloodstream. When you're releasing the toxins, can it accumulate more in your brain? I mean, because it's still in your bloodstream. I mean, just what's not on your skin, it's in your bloodstream.
Yeah.
And
Yeah.
it can still, because, I get loopy sometimes because of it. And so what I realize is, when I do this, I need to take a binder or something so that I don't, I just can get out of my system. And I found that helps. But, can it help, can it cause more of a problem when you have all these toxins, released into your bloodstream?
Well, it kind of comes back to where do you start? Like, do I tell people to jump into detoxing in the beginning? No. So you start with the gut. You make sure people are eliminating, that they're not constipated, because those are our biggest, things we're eating. And if we're constipated, then those toxins are sitting in our body instead of going out the other end, right? So there are there's a wonderful paper that Mark Hyman wrote a million years ago called The Right Order of Things, and it's kind of the order, that I learned to do things in functional medicine. So I wouldn't jump somebody straight into detox that was toxic. And even then, I know, for myself, when I was so sick and toxic, I couldn't go in the hot tub at all. If I went in there 5 or 10 minutes, I would be wiped out for hours. It mobilized too much for me. I definitely have toxic issues. So some people, I tell them, start with 5 minutes in the sauna, and then work your way up. And other people, I'm treating a young man, very healthy, 31 years old, eats a perfect diet, and he has had ulcerative colitis, for more than a decade, and he used to be a semi-professional tennis player and was the head of the tennis team at Princeton. And turns out he's really toxic on like some of the plasticizer things that we realized are from the tennis courts that he was on. But because he's really healthy and does everything right, he immediately was able, he does an hour, a time, 3 or 4 times a week right now. He's a good case because I'm going to test him again because he's aggressively doing it in 3 months to see, because that's what I've learned is if people do this and can tolerate it, you will see the numbers come down in 3 months.
So what is the order you use for this lady?
The order. Well, that's the thing. We've discussed it, and with, the situation with her being, in a memory care center, that's a small place, and they don't, it's just really not an option for her. And so we're just, we're kind of doing status quo with the other support we've done, that she's happy and not declining. And so we're not being aggressive in that regard. It was just too late to find that out for her, but not for her daughter.
How about IV C and glutathione, that wouldn't help to lower things more aggressively.
The C in which one? Glutathione?
Glutathione and C.
So the problem you have is, when I used to go to nursing homes and work with people in my studies and things, and, the system, it's too difficult. You have to transport the patient, you have to, and all that takes like lots of money, lots of resources, lots of coordination, and it's just not easy to do. If you had somebody in the home, I used to have a great IV therapist who made house calls for people. I could use that again. She moved to Colorado. So I think I put this is in your handouts, just some basic nutrients. Obviously, you've got to customize things. I don't use a lot of nootropics at this time, some of the things that directly stimulate the brain, because I usually have so many other supplements. I'm trying to correct their low iron or their zinc, or, and how many supplements can people take, but those are some of the better validated ones there, and it's in your handout that I gave you. I spent a lot of time trying to put stuff in that handout. That's why I was last minute getting my slides here. But those are some useful things, and I wouldn't take all of those. Actually, I didn't add to that one that just jumped to my mind. There's some really nice data with whole coffee fruit extract, WCFE, and there is some really nice data that it increases your BDNF like 6 times or something by taking that whole fruit coffee extract. And Allergy Research Group has a combo thing that has a dose of that is reliable. And we've known for quite a few years that if you drink 8 cups of coffee a day, you have less Alzheimer's. So and that's it. That was the stratification. 8 or more cups of coffee. Maybe the antioxidants offset the toxins in the coffee. All right, well, I think we better call it a night, but I'm happy to stay here and answer any questions. I just don't want to keep anybody that needs to go. I know you guys have been here a lot of hours, but I'm grateful to be here, and I hope more of you will, keep learning this, because there is an endless supply of people, and really what we need to be doing is prevention. We need to test people at 30. We need to test them at 40, at 50. We need to know these things, like my young tennis player, that to find all his toxins now before he has, dementia 20 years from now. I think that's really where we need to be putting our efforts. Thank you for having me.
So, Dr. Toups says she would stay a few more minutes to ask questions or answer questions. So I wanted to bring up the first question from my colleagues with Silverado long-term care. As I talked to you, a lot of the testing and some of the tests, some of the clinical trials with Dr. Bredesen are about mild dementia. Well, when we go to the facilities of memory care, well, they're not mild. They're moderate to severe. But when I talk to family members, they want some hope. So my question to you is, people who are starting to either lose speech or have unintelligible speech, is there any studies that they can get their speech back? And number 2 is, a lot of times they're at that point where they can't remember their family members. Again, is there anything we could do, or maybe, we have access to a lot of patients, possibly we could do a clinical trial where we could see if we could get them to remember some of their family members. They're not going to walk out of there or drive a car or do these things anymore, but what's your experience on that? Because I know it's heartbreaking for us to see these patients and in our long-term memory care. When I go in there, I really...
And they're us. They're our families, right? It's 50% or more of us that are going to get dementia at this point. So there are no studies, right? Even this whole approach to say, for us to sort of have the goal to say, wow, we can do something about it. But we're seeing it over and over. And in my study group with Dr. Bredesen and I have, the geriatrician from Cleveland Clinic, and, we discuss cases twice a month, and we're all having successful cases. So, you're going to have less traction the farther advanced someone is, but there's some easy stuff that can be done with not a lot of money. Work with the diet, test all the nutrients, test if people are willing to explore hormones. The testing that I can get all this testing for the most part from Medicare on my patients. They're paying, the only testing of the things that I mentioned that I can't get on Medicare, the toxin testing is not covered. It's $219. The metal testing is not covered. It's $165 $160 plus the cost of the chelating agent for the provocation, another $30. So, I'm at like what, $420 right there. I mean, I get a really nice battery of basic labs, using True Health. They have a beautiful, I can do 4 tubes of blood with a 9-page report. So that then leaves more tubes of blood that I can do through Quest and LabCorp to do the Sears testing on all the infections and things like that. And so the Genova Nutraval is covered for Medicare. I use that. I can get a nice, snapshot of all the nutrients and some organic acids and a little toxin. So a lot of this stuff can be done, not for a lot of cost, right? And then if you could get a nursing home that's on board with working with a diet, because of course the diets are atrocious in long-term care facilities. They're atrocious in hospitals.
They're high sugar,
and they're all carbs. So what if we could change our diets? Then the people who work there would start getting healthier, and the administrators would come for lunch, and but it's I mean. I had just taking people off the gluten is such a fantastic thing for decreasing inflammation. And I once had a patient with schizophrenia who was in a long-term care facility, and I wrote the order for them to take her off her gluten. And the nutritionist called and argued with me and said, "No, we can't do this. She's going to have to eat glop with no gravy." And finally I said, "I'm sorry, but this is my order, and you need to take my order." Well, the woman, the first time she saw me, spent the whole 2 hours going, I'm scared, I'm a good person, I'm a Catholic. And 5 weeks later, she came and sat with me for 2 hours, and she was calm, and only twice she started to get a little anxious, and I would just, let's go weigh you. I mean, this was 1 month off gluten. That's all we had done. And what that did for her brain, it was amazing. So I think that it would be awesome to have some long-term care facilities that wanted to do something like this, and I think we could design it for,
we could design something.
It doesn't have to be like ungodly
even B12
expensive.
or vitamin D, vitamin K2.
Exactly.
I mean, you don't have to put them on $1,000 thing or put them on IV glutathione or IV. It's basic stuff. I think we could help, and if the families see this improvement. I mean, we have people here that have family members that have Alzheimer's, and I know they want to ask you questions, so I don't want to take over too much. But is there a way people can get in touch with you if they don't have time or have to leave? Is there a way that they can see if they want to?
Oh yeah, I brought some of my cards.
Okay.
And but my website is on your handout there. And so, I have some cards here.
Great. Anybody else have a question? You can use the mic if you want it to be recorded. Raise your hand. I'll pass it to you. Any questions? No questions?
Yeah.
Well, you mentioned pea protein, and those of us who drink protein shakes every morning are using pea protein. So what do you say about that, and what is your assessment of his findings? The lectins.
Well, as Dr. Rajani said, it's only a problem if you have a breach of your blood-brain barrier, and then you're making antibodies to that, and it's cross-reacting with amyloid, because you probably have amyloid in your brain. I know I do. After a certain age, we all had things that we're starting to get amyloid deposition. So if then that crosses through there, it's fine. But if you eat it and your gut is healthy, then it's not going to go into your bloodstream from your gut, and therefore then it can't go across your blood-brain barrier. So, if you feel like you're healthy and your gut's good, then I don't think it's going to be a problem. Yeah.
Would you basically recommend this approach for most of the neurodegenerative disorders, not just dementia?
Absolutely. That's a great question. So, this general approach, I use it for Parkinson's, I use it for MS, I use it for all my patients. I mean, you personalize and you find what are their factors, but absolutely. Yeah. Yeah. Yeah.
I was curious what your opinion is about tinnitus. Have you ever... Because they're saying now it's in the brain.
Right.
Tinnitus, and it's not in the ears.
I have to say that I have tinnitus, and for whatever reason, lately it's been better. And I did turn out to have some mold in my house, and my mold markers were high, and then they got better. And I do think there is something with neuroinflammation and the tinnitus.
And what about urinary incontinence? What do you think?
Hormones can be helpful for urinary incontinence. for a man too. I mean, the hormones are trophic for the ureter, and so it's a factor in men or women.
I'm a nurse. I can do your
And well, I don't know. I was at this one conference where they were talking about what do they call it? The vaginal. They use lasers for the vagina, like for improving the vaginal tone and function. And I thought, well, that sounds like a waste of money, right? Like, who would want to do that? But it turned out there was like really nice data of things that it helped with, including urinary incontinence. And that guy said for some of his patients, he also injected stem cells into the urethra and got good traction. That sounded pretty painful to me, but if you have urinary incontinence, it's a debilitating problem, right? So yeah.
Have you heard of the use of the laser on the brain for cleansing the brain and cleaning out the brain? I know one chiropractor in particular, I'm a chiropractor, that advocates it and does it every day himself.
Yeah, so there's some cool data with the light stimulation in the brain, and they did it with rats, a really good study with rats, and they put rats under some certain frequency of lights, and these were Alzheimer rats, so they have a strain of rats that's engineered to develop Alzheimer's, and then they put them under the light stimulation, and then they could run the mazes again. The problem with that, with the rats, was that they had to have it 24/7. And when they stopped it, they would just revert back. So there are some different gadgets, and I know people that really like the Via light, which is one that you put like in your nose that shines a light, and then you put something on the outside of your head that creates something. And Jill Carnahan is somebody who treats a lot of mold and cognitive patients, and she has the similar issues, and she loves that device. She said for her it was incredible. She uses it every day, and I think their protocols say use it a few times a week, but they have two different versions, an alpha and a gamma, and one of them is supposed to be better for the brain. I believe it's the gamma. I've had some colleagues say, nah, I tried it, it didn't work, and some people say it helps. So I guess that story is still being written, and I think if it's something, you can buy these devices that are not cheap, but if they help you and you find you have the time, like if you ever sit down and watch TV, that's something foreign to me, if I'm not working, I'm still researching. But, if you have time that you could do things like that, like it seems like a reasonable thing, I just don't think there's not like hard data that tells us who or how much you have to do it, So the rats, that was a concern. For me, I decided if I had to do it every day, I wasn't going to do it. It wasn't, it's enough trouble getting in the exercise and the meditation. Did you have a question?
Do you recommend all the children of patients with Alzheimer's to be genetically tested?
Well,
because the reason why I'm asking that question is the question about stress, if they find out.
Yeah.
And its contribution to the development of Alzheimer's.
Yeah, no, I don't think children should know anything about, genetics or things like that.
The older ones.
But, well, I think it should be a general global awareness, separate from the genetics. I mean, some people, knowing they have the genetics, they'll be more willing to take action. It's like the gluten. I personally I work with enough people. I know what gluten does to the gut, and I don't think it's healthy for people to eat gluten. And so I don't spend any money testing them, but I have certain patients that they aren't going to do it unless they see that it's causing them a problem. And sometimes when I test them and they see that they're having all kinds of antibodies, they're like, okay, now I'll stop my gluten. So it just depends on the person. I think, the biggest thing is that, if you eat crap and you don't exercise and you don't get enough sleep and you drink too much, like your brain's going to suffer, and so it just depends how motivated people are, to protect their health. But so the genetics, I mean, I do it just because we're trying to learn about these things and understand how differentially people respond to like the diets and other interventions. But I don't really see a need unless somebody needs that for motivation. Because I was a 3-3, so I have no risk for Alzheimer's. Nobody in my family had Alzheimer's, but I was pretty demented. So, that's not the only cause, is that just you could say, well, I don't have those genes, so now I can, have a crazy lifestyle. Then it's not going to necessarily help. You might use it as an excuse. Yeah.
I'm curious for your, episode of Alzheimer's. You've always had low cholesterol. So
Yes.
was there some other trigger on top of that?
Well, there's always multiple things. I mean, I was running a research business, which was very stressful. I raised a very high-need kid, who had off-the-charts ADD and bipolar from the time he was little. And I always do lots of things, I'm a kind of an intense, person and like to do a lot of things. And so I had a lot of stress. I was going through menopause. But basically, I really developed chemical sensitivity. So maybe all that stress ate up my gut, which then, led to the cascades that I suddenly got reactive to everything. Though I'd always had immune problems up and down in my life. And, so those things are a factor. Before I crashed and burned with that dementia, a few years before that, I had more classic fibromyalgia, waking up with my joints all swollen and lymph nodes and fevers. And I probably had Lyme disease then. And, because I have immunocompromise, I have low T cells and I have low immunoglobulins, so I never mount a response to Lyme testing on the bands. But I've found out through some other ways now, with genetic testing and the LE spot T cell testing that actually I definitely have had Lyme and Babesia, and probably that was one of the precursors. I mean, so it's like multiple things, and that's the thing. You work on those layers and then fix all those things. So, fix my cholesterol. What's that?
Lyme's never alone. There's usually like EBV or CMV or other co-infections.
Yeah, exactly. And, and then maybe if your gut's good and your hormones are good, you're going to go through that Lyme and your immune system's going to take care of it, right? Many people get Lyme and they have a weekend flu and they're fine, right?
Birth control at all, may I ask?
Which one?
Were you on birth control at all?
Was I on birth control? When I first started the menopause transition, and for me it was like early 40s, and they put me on estrogen, and then the World Health Organization report came, and I'm like, oh, I'm stopping that. It causes cancer, right? And so then later they put me on the NuvaRing. And that was not good. Not good, and not the right thing to do, as I learned later, but I didn't know at the time, and it definitely destabilized things with yeast that I had long had under control. And I kept going to my, my doctor and going, does this stuff cause yeast problems? Oh, no. Finally, I looked it up.
And I got dementia.
Yes.
Well, it was chronic fatigue, but actually when I reviewed Rose's protocol, I actually had dementia.
Yeah.
And I had systemic infections because of the Mirena, and it causes gut problems. All of birth control and synthetic hormones cause
Well,
gut
the problem with birth control is it's not hormones. They're endocrine disruptors, right?
Yeah.
They're not even hormones. So you think you're taking hormones, and it's important for any of you with, girl children and, young women, because it's, look at your toxins. Those things are endocrine disruptors. That's what they're designed, is to screw up your own hormones by giving you this stuff. So yes, it's a huge thing.
Is there a study that we can actually point to, because I have a 10-year-old who's going to be going to middle school next year, and he has to get the HPV, right? So is there a study that we can present to the school board or some, people that determine, what our children are exposed to, that can show them that HPV, how dangerous it is. I mean, we know that it's dangerous, but we need to show them that they cannot do this to our kids. So do you know
Right? Yeah.
resource?
I have a couple friends that are very active in the physician vaccine movement, and there is a physician group that a couple of my friends are on the board and work with that put together stuff like that. So I'll try to get that information for you. Yeah.
Is it illegal in California to refuse?
So you have to have an exemption by your physician, and
I don't think they even accept that anymore.
They don't.
And
The law that passed.
the new one.
Exemption by physician.
You're forced to homeschool.
Yeah, you have to homeschool.
Is that something that just happened? Because I know the one that happened, but they were still accepting them, but there are certain criteria.
They passed a law. I was involved in this. The chiropractors were front and center, and we took a lot of flack for it.
Yeah.
But the first law was that you had to go to your physician. If you wanted an exemption, you had to be talked to.
Right.
They didn't. So we are arguing. So that went on for a year. Our argument was that the vaccination rate actually went up. So that was working, that people were being convinced by the physician. And then they said that's not enough, and I think it was this. It's a physician over in the valley. I forgot his name now, and he's an obstetrician, I believe, and he is in the assembly, or he's in the Senate, and he was the guy who instigated. Well, now we have to require it, so now it's drop dead. You have to have it. You have. There's a list of like 7 or 8.
I know there's still some things, because I know that I do know some people that are still giving some exemptions, but I mean, in the HPV one, gosh, yes.
Yeah, I think that you have to, if you want your kid in public school,
Yeah.
you have to get it. If you don't want them in public school and you want an exemption, you do have to homeschool.
Yeah.
Yeah, I think that's the exception in this whole. That's what I'm thinking about at this point. Even if you send them to a private school, they have to pay for that. Any public organization that they join, they're going to require that your child have.
It's tough, because what I have read, and there is some data, they say that more young women have been harmed by the HPV vaccine than will ever get ovarian cancer. But I don't know the data for the men and the oral pharyngeal cancer. But I mean, the problem for the girls is that it causes premature ovarian failure. So you're giving them this something to protect their sexuality, and then you're taking away their childbearing capacity, you know, not to mention that some people clearly with compromised immune systems go down the tube. So that one, to me, seems to be the worst of the ones out there. But it's a sad situation. I have one patient who she took her kids to Kaiser, and she took her daughter, who was like 17, and they, tried to pressure her, no, the boys. She had 2 boys, and they tried to pressure her, and she's like, no, we're not going to do it. And then she went in with her daughter, and she'd already told her daughter, they're going to pressure you about this, and we don't want to do it. So they told the daughter, they sent the mother out of the room. They told the daughter, you do not have to listen to your mother. We're the doctors, and we tell you you need this.
At 12, right?
She was about 17, but she was under 18. It's a parent's job to protect their children, and they told her that she didn't need to listen to her mother. I told her she needed to go to the press and she needed to file a complaint, because, I mean, what an atrocious situation that we're, having doctors splitting the parent against the child. I mean, it was appalling to
They don't
me.
do that in other countries, do they?
I don't know.
No, other countries, whole Europe, European countries, Canada, their immunization starts from 1 year old. And there is an option to immunize, but they start 1 year old when immune system is more stabilized.
Sure.
Yeah.
And I wanted to share this case that I had actually. They flew all the way from Washington. Mother and daughter, they used to live in California, and I used to see them as a patient. And they came in because daughter got HPV vaccination, and the outcome was kidney glomerulonephritis, kidney failure, autoimmune kidney.
I mean, everybody I know that treats kids has seen vaccine reactions. It's a reality.
And then mother was saying like and daughter is now 16, that she never been the same after HPV vaccination.
Yeah, that one is particularly problematic.
Yeah, it is, and it is.
And it's scary. If you have immune in your family, it's scary. Yeah, I gave my son the first one. My son's 25 now, and I didn't know functional medicine, and I gave him the first one, and then I started thinking about it. I mean, in medicine we're just trained to do what we're taught, right? Don't think, just follow the protocol, right? And you have to sort of learn to think for yourself to really figure out, that much of this dogma that we've been taught is wrong, and there is no data for stuff that we're told is dogma, and it's been quite a shakeup. So yeah, once I learned a little, I didn't give my son anymore.
Exactly, I have 26-year-old.
Yes.
I gave the beginning at the beginning requirement.
Right.
But I didn't know better at
Right.
that time.
Right.
But then as soon as I realized what's the pattern, and
Right.
actually I have pictures before and after he was immunized, and that was different. And we worked for a long period of time to rebuild the immune system and do other
And sometimes the first sometimes sometimes the first vaccine may not do it, but it starts waking up and priming the pump, and then the second or the third one is when you'll see somebody go into a tailspin with the immune stuff. So. It's a good point in general, the notion of vaccines, because when I'm working with my dementia patients whose brains are already overcome with, toxins and inflammation, I don't want them to be having any vaccines to trigger their immune system. So, the goal of any vaccine is to trigger an immune response. And if your immune system's already saying, then why would we want it?
There's all sorts of things they put in there. I mean, look at the ingredients.
Yeah.
Even on so-called low dose or whatever. I mean, it's pretty scary, and some people are going to react to it.
Well, because the only way to get a vaccine to work is you have to pair it with some kind of excipient that your immune system is going to recognize as a problem, and then your immune system is going to build antibodies to that. So that's the whole notion of vaccines, that there has to be some kind of excipient. And so, the notion of can we make safer vaccines with cleaner excipients, yeah, that could be done. But if you or anybody already in an immune spectrum, you don't want to be revving up your immune system. Like we're trying to quiet down the immune system, not rev it up. It turns out to be the same thing with tattoos, because the way that the ink in the tattoo stays in your skin is that it creates an immune reaction, and then somehow that makes the color stay. Otherwise, your skin sheds, so you would be just shedding the color. So that's how the tattoos work, is it's an immune reaction. So I don't think people with immune problems should be having tattoos either.
Are you seeing any kind of correlation with this new host of vaccines we have to give to everybody over 65? All the pneumonia vaccines and the Zostrix and all that stuff. Are you seeing any correlation?
I don't know. I mean, I don't see big enough numbers of people personally, to know, but I do tell my patients, like, you're already sick, don't take this stuff. Because they're going to weather the flu well if they're already taking a good diet and taking good nutrients. Vitamin D is fantastic for the immune system. Vitamin A is great. And one of my functional teachers showed us data years ago. He said, I quit taking vitamin C in the flu season. He says, there's really nice data. You take 50,000 of vitamin D for 3 days and it revs up your immune system. Yeah. I've done that many times. Like if I wake up, sick and like, oh, I'm going down, and I take that, I'm fine, works great. But the D is better than the zinc.
I see a list of people with pros and cons of the viral immunizations.
Yeah.
So from scientific point of view, since viruses mutate very fast and don't create permanent immunity, I tend to explain them that, and what is the chance that at the same time I will have that cocktail of many viruses attacking, even inactivated, they're going to create immune reaction in the system at the same time. And then if our immune system is strong enough to fight in a bloodstream and protect not crossing blood-brain barrier into creating where they usually viruses hide because of low T cell or no T cell presence, then those viruses gonna migrate to nervous system, affect neuroplasticity, neuroinflammation, and then live there happily ever after if the body cannot fight them. And what is the chance? If one influenza I have to deal with, then I explain and give patients a choice.
Right. I mean, it just occurred to me, like, there's these massive campaigns to vaccinate everybody to prevent these diseases, but instead, what if we just fed them all better? Then their immune systems will work, the viruses would cause a little problem, they'd pass on through, chicken pox as a kid is no big deal, right? Chicken pox as a kid, you lose a couple days, it's no big deal. But you get as an adult,
Yeah, but then the food industry couldn't sell us all this junk they wanted to.
Therein is what's dictated all of our policy. What is our nutrition? It's all come from the food industry.
So again, we want to thank Dr. Toups for her gracious talk.